My name is Dr. William Thomas Long of the Arthritis Institute at Good Samaritan Hospital in Los Angeles, California. The reason for shooting this video is to get information out to patients around the United States and the world regarding the failed Durom cup by Zimmer. The Durom cup is a portion of a total hip replacement system by Zimmer Corporation, which is associated with the loosening rate due to failure of bone ingrowth into the cup. We will hear from patients that have experienced failed surgery due to a loose Durom cup. By listening to the words of these patients, patients will recognize their own symptoms if they are the victims of this failed implant, and surgeons will learn to recognize the complaints that will lead to the correct diagnosis of a failed acetabular component due to a Durom cup.
I've had pain in my left hip since the cup was put in, and the doctors would tell me, you know, that's normal, you're gonna have some pain, but the left side actually felt like it was kind of on fire, and it was really burning and hurting all the time, and I just figured that was maybe from the scar or, you know, whatever it was. But, you know, as time went by and I would bend down to pick something up, it would hurt. I would stand up and I couldn't get going again. I had this pain, which is now that I know it's called startup pain or starting pain. When I would try to walk a couple steps and I was like an old man, and I was, you know, 35 years old at the time, and I'm going, is this what my life's gonna be like? And I just kept thinking, you know, that every day I'm gonna wake up, I'm gonna be in pain. My right hip is fine. I don't know what's wrong with the left one. They put the same parts in both hips. You know, I guess Dr. Long and Dr. Dorr had figured out that there's a serious problem going on here. A lot of patients complaining of hip pain, a lot of patients complaining of what I complained of, and I guess maybe I was among the first to really actually complain about it, probably because I was working out a lot and trying to get back in the gym and do these things. So it really affected me a lot more than maybe somebody just walking down the street. But I couldn't pick up a laundry basket off the floor, and that was, to me, the biggest problem, was not being able to carry out my everyday activities. It's hard to describe to somebody exactly, you know, where the pain comes from, what you're actually going through. You know, for me, when like I said, I would bend down and I would stand back up, and it would just kind of kill, it would just burn, and like it was really this sharp pain, and it would take me a couple seconds to be able to walk a couple steps. Now, that pain was radiating so deep inside the hip that when I went to Dr. Long, it was hard to explain to him where it actually hurt, because, you know, the doctor always says, point to where it hurts. Well, I couldn't point to where it hurts because it was so deep inside of me. The other thing that was brutal, like the worst, was the groin pain. When I would lift my leg up, there would be severe pain deep in my groin to where I really couldn't lift my left leg up at all. My right leg, I'd be, you know, I could throw up over my head. My left leg, I barely could even lift it without pain. It would hurt when I was, you know, I would be uncomfortable when I was driving, because when you're driving, you're sitting in a certain position, and after a while it would kind of bind up. That muscle would be really tight. The muscle was really weak. All the muscles surrounding the hip joint, the hip flexor, all that stuff was really weak due to the fact that this cup was in there moving around. And that just shows you, you know, I think a definite problem with the Durom cup. And I think that, you know, I've known a lot of people that have had hip surgery, and I'm telling them all, if they have any pain, you know, just go see your doctor and go see what's going on, because, you know, if you have a Durom cup in, and I still do have one in the right side, which is to say, you know, it's not going to fail in everybody. So the right side seems to be fine. It seems to be working. I do worry about it in the future, if it's going to be working, if it's going to be fine. But, you know, for right now, the left side had to be redone, and they popped out the cup with no problem. They put in a slightly larger cup and fixed the hip. And when I went back for the revision, honestly, it was night and day.
One of the most frustrating and difficult problems with the failed Durom cup is difficulty in making the diagnosis early. The patient complains of startup pain, pain when rising from a chair, when entering or exiting a car, or when going from standing still to walking. None of the patients could walk half a mile or a mile without increasing and sometimes excruciating pain. Despite all of these clinical findings, the X-rays remain normal for up to 1 year after the failed operation. After 1 year, a dark line will form around the acetabular component, indicating failure of bone ingrowth. The purpose of this video is to facilitate an early diagnosis of a loose Durom cup. By identifying the loose cup early, it is possible to explore the hip and remove the Durom cup and exchange it for another acetabular component with an excellent track record of bone ingrowth. If you believe that you have the symptoms described by the patients in this video, please notify your treating orthopedic surgeon about your concerns or contact us at the Arthritis Institute at Good Samaritan Hospital in Los Angeles, California. Thank you very much.